Welcome to this open online briefing offered by Forest Foundation. I think all of the people I see connected, you are used to these open online briefings. We will start with an update on the global health situation from David Nabarro. Today, David wants to share with us the latest news on COVID, but also feedback on discussions that have happened in New York last week during the high-level week of the UN General Assembly. David, I think we don't need a longer you don't need a longer introduction. So please go on. I'll come back after David to give you the floor for your questions, comments, add-ons on the topic, or any tangent thoughts that bring us in the sphere of systems leadership, maybe. David, to you.
Thanks a lot. People joining from as far afield as British Columbia and Nairobi, people who are very active in long COVID, also in West Sussex Primary Healthcare Trust. And Lynn Brown, it's wonderful to see you after a long time. I think you might be calling in from Washington, not sure. Jean-Luc is as well. And so just greetings, greetings, greetings. Thank you for joining us. We use these moments to share updates. We particularly focus on Megan's here. Oh, yes, I didn't see. There you are, Megan. Yeah. We use these moments to really reflect on most of the public health issues that we're seeing. But really, because everything is so interconnected, I would like to share with you what I saw happening in the UN General Assembly. Hello to Mike. Welcome. Just saw you come up on the screen. So I want to go into the conversation today by reflecting on what WHO's Director General Tedros Adhanom said in his media briefing earlier this week on the 27th. And I will quote one or two things from him, really to stimulate our conversation. He says, as the Northern Hemisphere winter approaches, we continue to see concerning trends for COVID-19. Then, among the relatively few countries that are reporting hospitalizations and intensive care unit admissions have increased in the past 28 days, particularly in the Americas and Europe. Meanwhile, vaccination levels among the most at-risk groups are worryingly low. I mean, it's more than just worryingly low. The whole COVID vaccination issue has become amazingly political in the United States, with Ron DeSantis, the Republican contender, saying if he's president, he won't put any money into COVID vaccines. Whereas on the other hand, there is a fair amount of data coming from various meta-analyses that say that actually COVID vaccines have done a remarkable lot of good and have certainly prevented deaths, but they've also probably reduced the incidence of some of the other sequelae of the infection. And so only 1/3 of the world has received an additional booster dose. 2/3 of the world have received two doses. And this is really quite worrying because the new variants that are moving around are pretty good at dodging the vaccines. And I think most of us realize that being up to date with your boosters is really worthwhile. I have to even say it to myself. I'm in the high-risk age group, and I'm quite good at putting off the booster thing. So I think my first suggestion to everybody is that they do think about boosters. There are some schools in Geneva where there is such a concern about current levels of infection with the currently circulating variants that teachers are asking parents to wear masks. And indeed, some of the children are wearing masks, and physical distancing is being encouraged yet again. And this is not a city or a country, that's Switzerland, where those kinds of guidance are being given mildly. I think that this does show the concerns. We've heard the same from hospitals in the UK, hospitals in the US, and those of us perhaps who've been traveling a lot recently see many more people wearing masks, particularly if they think they might be carrying COVID. So it's a sort of tricky time. I went to WHO colleagues and I said, what are the latest numbers? And they said to me, the real problem is this very low percentage of countries that are actually reporting statistics, and the systematic undoing of the really quite extraordinary reporting system that was in place between 2020 and 2022. So it means that even though we know that there are new variants moving around, particularly the numbers are a bit difficult, VOLEG5 and VUMBA286, that one's the one called Pirola. Even though these variants are moving around and moving around really quite fast, as far as we can tell, the WHO colleagues still do not feel they can say with any certainty, based on epidemiological data, that these viruses, these variants are less severe in terms of their clinical consequences than the earlier variants were. So it's a bit of an unfortunate situation, and I'm fully understanding how embarrassing it is for Tedros and for Maria Van Kerkhove, the clinical lead, the lead there on HIV epidemiology, to really say with any certainty when journalists asks what is really happening. There is one piece of slightly troublesome data that has appeared. There's a drug called Paxlovid, which has the generic name of molnupiravir. It's actually a combination antiviral. It seems to have greater efficacy in preventing hospitalization when people have got severe COVID. But we have recognized that with people who are treated with this drug, after they've finished their treatment, they appear in a few cases to get a sort of rebound and then become infectious again. And there's been some work that's suggesting perhaps that people who are taking this treatment may be more likely to have rather nastier forms of the virus. Is there perhaps a possibility that the medication contributes to the emergence of resistance and new variants? So that's all under study, and one's always nervous about early data on what's happening with the medicine. So the official story is molnupiravir or Paxlovid is not being considered a negative thing. In fact, the general line is it's pretty good, but we are watching because of these anxieties that there may be emergence of resistance in some people treated with this drug. I wouldn't be surprised, by the way, if when looked at over the years, this turns out to be the case, simply because this is an incredibly rapidly mutating virus, and we expect new variants to emerge from various different treatment regimes. That's why some of the early data suggesting that people who were immunosuppressed, who had very, very long duration infection with their COVID, might also be more likely to be people in whom new variants emerged. And it all makes sense, doesn't it? Now, what about the variants? Well, EG5 is the one that is now accounting for about 1/3 of all viral sequences that are being looked at around the world. And the latest risk evaluation from the WHO and from various national groups is that it's not causing more severe disease. The one that's doing the rounds in Europe now, that's been reported from 21 countries, but the numbers are a bit too low to fully ascertain the trends. That's the one called Pirola. It's not enough data for the WHO people to be sure on severity, or indeed sure on the efficacy of vaccines. There's been quite a lot of debate about COVID-19 origins. This is hugely political, and it's the politicization that's made getting information about what were the early data were like from China, particularly from Wuhan, really, really difficult. And because the whole question of origin has got caught up in geopolitical discussion, my own view is it's going to be very, very hard indeed to get an answer. There's people accusing Tony Fauci and even USAID funding bodies like the National Institute of Health for being complicit in the emergence of the virus. Very, very difficult. But Tedros has taken a fairly firm line saying we do want to try to find out how this virus originated, not least because it's important when thinking about the next pandemic, what some people are calling disease X. Now, I want to just finish by saying that there's also a lot of stuff being written about long COVID. And there are people on this call who are extremely experienced in this issue, and some people who I know actually have experienced prolonged symptoms following COVID, and some of you have even had this on multiple occasions. I don't think for now that there's clear evidence that long COVID is one condition. I think it's a multiplicity of conditions. And I also think that there is clearly some combination of factors here, just as we found with chronic fatigue syndrome after other viral diseases. It's a difficult thing to disentangle. But the work that's being done on clotting and microclots, I personally believe is important for some people. And indeed, the cardiovascular aspects of long-term COVID infection are clearly important because we do know that there is a heightened risk of myocarditis and indeed of cardiovascular episodes after COVID. And so it would make sense for there to be some signs of cardiovascular complications. But there's also likely to be some challenges for people's cerebral function as well. And it's perfectly reasonable that this could be a multifaceted syndrome with various causes. And I do welcome further discussion on this, particularly those of you who are directly involved in various working parties. Either way, the debates about long COVID and the fact that people are going into newspapers and even into parliaments and having quite heated discussions about it doesn't help to get adequate support for people affected by long COVID. And I was reading in the British Medical Journal recently an article by a number of, or quoting results from a number of medical practitioners. 1 in 25 actually healthcare workers affected by long COVID, a big growing sense that there are lives being destroyed by COVID, and a sense also that perhaps there is not the level of care, the duty of care by the employer being provided for these people. Well, it's always going to be a bit of a debate, especially with uncertainties being expressed so publicly about the nature of long COVID. But I think that I join many others in saying, just because there's debate and uncertainty, that doesn't mean that funding and support should be skimped on this one. It's just too serious. And this is an illness in case of many healthcare professionals that's been caught as a result of them doing their work. Recently, I have hearing loss and I went to see an ENT specialist locally here. And she said to me, this has been terrible for people working in ear, nose and throat. They've been getting it and getting really ill. And they perceive that they as a group need very special support. I see Claire Rayner nodding, and she's an occupational health physician and will comment, no doubt, in a few minutes. So I just want to say to everybody, COVID has not gone. COVID is still a massive public health issue. Unfortunately, people like myself, my colleagues in WHO, are not easily able to provide a clear set of statements about what the virus is doing, because the brilliant tracking that we had has been dismantled, in some cases rather hastily, because quite understandably, societies want to get on and recover, and they want to get back to meeting, and they found that the restrictions that were placed on life, particularly in the second half of 2020, when nearly half the world was in some form of lockdown, have had terrible long-term consequences for lives, livelihoods and well-being, a huge challenge for children's education, really big impacts on society. And so, of course, people don't want to go back, but at the same time, it would be incredibly unwise just to turn our backs. One person here wrote to me just questioning about, what about all these non-test results? Why aren't test results being reported? And I agree with you, this is a big issue. Now, I want to slip, if it's okay, Florence, quickly to our experiences at the UN General Assembly, which took place in New York last week. It's the annual meeting of just about every government at pretty high level. You don't get all the heads of state and government arriving, but an awful lot of presidents and prime ministers are there. Usually it's in the 150, 160 mark out of the total of 195 approximately of actual governments. Well, it's a bit lower this time, partly because a number didn't want to come. I mean, there are big geopolitical tensions because of the war in Ukraine. So yes, the president of Ukraine came, but not of Russia. And also China was represented at ministerial level. But also there is a little bit of frustration on the part of the UN side, the Secretary General in particular. He's organizing a number of summits each year in the UN General Assembly. There was one on the Sustainable Development Goal, one on climate, one on financing for development. There were 3 on health. And really unfortunate that the Secretary General was so frustrated with a number of countries actually seeming to go back on pledges to move quickly towards net zero in their energy balance sheet, net zero emissions, that is, that he did actually suggest to some heads of government that they would not be welcome at the Climate Action Summit. I quite understand that. The mood in New York about climate was palpable this year. I went to sessions in the summit on the Sustainable Development Goals. I went to a bit of the Climate Action Summit, and I participated in lots of meetings in the margins. And there were concerns about the fact that there is fragmentation of the global consensus on the Sustainable Development Goals, and overall assessment suggesting that the rate of achievement compared with where the world should be by 2030 is rather low at about 15%. Mind you, these are very ambitious, the 17 Sustainable Development Goals. So I'm not going to myself get super upset about it. There's time to catch up. But still, the real anxiety is that more and more leaders, particularly leaders from poor developing countries that are being badly hit by climate change, they are saying that they can see that the climate is changing at an increasingly rapid rate. It's what we call exponential. We had it with COVID. Well, we've got it with climate as well. It's getting faster and faster. And leaders are feeling this. They're feeling it because their people are feeling it. And their people are feeling it because their farmers are feeling it. The farmers are the ones who feel it first because their climate is changing. It means cropping patterns have changed. If we look at India, which has had 2 years of really difficult times, they've got so worried about the impact of climate change that the government's actually restricted the exports of non-basmati rice. It's a pretty remarkable thing for India to do, a country that's hugely dependent on rice exports. But no, they've said we've got to prioritize food for our people, and so we're going to put an export ban on non-basmati rice. India's also worried because right now there's a pretty nasty El Nino developing. That's a hot current in the southern Pacific Ocean. and it builds up. It makes the ocean super hot, but it changes weather not just in Latin America, but also at the other side of the world, including around in India, Bangladesh, and in the Mekong Delta. This is the year where, for the first time at a UN General Assembly, I felt that there was an overarching sense of anxiety about what the next few years will mean because of the acceleration of climate change. We work in this UN Global Crisis Response Group. We're looking at how crisis is affecting people and nations all over the world. And we've seen that the world's been hit by successive shocks. COVID-19 was pretty bad. Not just the virus itself, but also the control measures. Then climate change accelerating really rapidly in the last 3-4 years. Then conflicts. We're in a very, very strong period of violent conflicts, a lot of coups going on, real instability right across the Sahel and in the Horn of Africa. And then added to that, there seems to be a really pernicious cost of living crisis that's probably been influenced by those shocks, but it's also influenced by the fact that really trading systems have broken down. And whilst that cost of living crisis seems to be coming under control just about in rich nations, it's not going so well in poor nations. And one of the reasons is that rich nations are dealing with inflation and the higher cost of living by increasing interest rates. So everybody notices this. I'm sure many of you have been affected by increases in cost of borrowing. It's been quite dramatic. And that rise in interest rates in the US, in Europe, and in other countries which use hard currencies, as we say, for their economies, has had a direct impact on the exchange rates for the currencies of poor countries. Like I said, Ghana, for example, the cost of a daily plate of food in local country, this currency, the cedi, has gone up 2 to 3-fold in the last few months. Same in Nigeria with the naira also devaluing. Now that devaluation, that increase in the cost of living because of the devaluation of local currencies has made life for poor people in poor countries immeasurably worse in the last few months. That'd be okay if the countries could do what, again, has happened in wealthy nations, which is providing benefits. It's never enough. But yes, there are benefits that come through. But what happens if you're a poor country? Well, 1/4 of the world's nations have such bad debt that they're spending more money at the moment, particularly following interest rates rise, in servicing their debts than they're spending on health and education combined. They've got no room at all to be providing more social protection, more nutrition assistance, more healthcare, particularly for women and children from poor communities. In fact, they're having to cut back because of the need to service debt. And the result is that during the last few months, we've seen how poor people in poor nations are just getting poorer. And of course, that means there are increases in the numbers of people who need food assistance and other forms of help. But it also means that we don't have the data, we just have anecdotes, that there are more and more instances of people really getting super, super poor with the attendant consequences that happen. They migrate, they may have to sell themselves as well as their animals, and they may also, unfortunately, get ill and die. And we've got some extremely worrying reports coming into the WHO of spreading cholera epidemics in different parts of Africa, also diphtheria, which is a sign of collapse of health services, also dengue, which seems to be as a result of changes in the distribution of the vectors. So added together, life for poor people we estimate about 1 billion of the 8 billion people in our world is getting worse. And there's no evidence it's going to get better in a hurry. Life for a quarter of the world's nations is not good because they are in big debt. And yet, of course, the wealthy, this 500 million, are doing fine. And there are plenty of billionaires and trillionaires doing very well indeed. Antonio Guterres, the Secretary General of the United Nations, has been really clear and has said this is an unacceptable state of affairs. At the beginning of last week, he got the new president of the World Bank, Ajay Banga, with him on stage, and they both were very clear that the world's financial system needs some very immediate attention to make it possible for the banks, that's the World Banks and what's called the multilateral development banks, which is the regional banks, to have much greater capital so that they can take greater risks and provide resources to these indebted countries and help them come through and be able to protect their people, to avoid having lots of situations where there is basically economic collapse. And the economic collapse tends to come also where there's conflict. So you get conflict, shortage of food, and bad climate, often presenting as drought, all coming together in bans in Africa, bans in Latin America, bans across Asia of terrain. You also get poverty among smaller numbers of people in the wealthy nations, middle income and wealthy nations, India, of course, lots because of the sheer size of the country, but also in the UK, as I've said before in previous briefings. So this widening gap between rich and poor and uncertainty about how the financing system is going to cope and the need to support countries as they get out of this was very much brought up by the UN Secretary General. The sense that climate change is going to make it worse in coming years was there as an undercurrent as we prepare for the next annual climate summit, which will be in Dubai in December this year. There will be a big focus on the links between climate and food. There's also going to be a big focus on climate and health. Yesterday at Imperial College in London, we launched the first global centre on mental health and emotional resilience in the face of climate change, because this new deepening of climate impact is having a really massive impact on the mental health of people, particularly young people everywhere. And as we are working in the midst of what feels like some very difficult crises, we're also seeing incredible efforts by communities everywhere to get on top of it. So it's a bit of a journey from COVID through to the global crisis to responses, but we find that everything that we do is interconnected because we work on systems. And I don't really want to apologize for offering you this breadth. And Flo, I'd now like to go back to you and see whether there are any points on this that people would like to comment on, either the very specific stuff on COVID or the more general stuff on the global crisis, perhaps in that order. And I've just started looking at the chat. I saw that, who was it? Yeah, Claire says it's obviously all linked. Over to you, Flo.
Yes, and heads up, David, there's also Hetty Schoenfeld saying there's also bird flu busy wiping our access to eggs and chickens.
Yeah, we had that yesterday. Gosh, thank you, Hetty. In our discussions yesterday on the food network that we have on the global crisis, and Helena Wright from an organization called FAIR said that even though governments are not necessarily dealing properly with avian influenza, bird flu, it's become a real issue for the industry, and the poultry industry has decided they've got to impose much more stringent biosecurity because of exactly what you said. Thank you.
Thank you. I was sure that would trigger you. Thank you, David. Anybody who would like to take the floor, please attract my attention as Farhang Tazib is just doing. So Farhang, the floor is yours.
Thank you very much, Professor Nabarro, for your excellent summary about COVID. It's a good education so that I don't have to read lots of papers and things. And it's always a delight hearing the absolute facts from a friend and valued public health leader about that. But I'm just wondering, whether in the light of your presentation, there's a common narrative developing around all these different issues, whether it's climate change, whether it's migration, whether it's COVID, and whether as a group, we should look at some of the common denominators of this so we can get focused about our advocacy work around these areas. I would be worried if we focus all our attentions on COVID because the death rates or so on may increase. I agree we need the experts to do something about COVID, but I think we recently had our public health board away day for the faculty, and there are many, many issues happening, and we need to look at the political determinants and form an alliance where we can tackle the underlying determinants, which I think are issues around global governance. And we often don't talk enough about global governance and the need for us to develop a solidarity around a common narrative around the issue. I'd be worried if we become siloed into individual issues rather than forming an alliance around the common denominators. I would value your advice about this particular approach.
And just to, if I can ask you, are you talking, Farhang, really in your role in the Faculty of Public Health Medicine? So that you're really thinking about it from a collective, or more in your professional role in your job? I can't remember where it is.
No, I'm sort of, I was thinking in terms of looking at professional public health values, ethics, and the legal frameworks.
Yeah.
We've recently formed a sort of global networks of public ethics and law, and there are common denominators in all this debate. So I'm just looking in terms of professionally and as advocates, we need to form some sort of narrative to reassert our values into action.
I totally agree. I'd like to hear from others, but I totally 100% agree, and personally feel that that has to be where I go next in my public health practice. I know that Michael Marmot agrees because we were able to talk about it during the last month. And I believe that my colleague in Imperial College, Aradazi, agrees as well. He was talking with me about it just yesterday. So yes, and I want to just hold it there because it would require us doing some work outside of this to think about the mechanics, but totally agree with you. Thank you very much for making the point, making it quickly. Let's just go on. I'm going to be quiet while Florence calls people in.
If you want to do it, David, I can be the one quiet. But now let's just go to Jean-Luc Poncelet. Jean-Luc, the floor is yours.
Thank you. Thank you, David. As usual, your briefing are extraordinarily clear in the very, very complex situation. I don't want to be more cynical that we tend to be all of us all together, but don't you have, it would seem that all those discussions, you know, the Assembly, the G20, the Europe, everything seems to be hiding what are the ones really taking decision, which is behind the scene. It would seem that the economical factor or the financial one are the one that is really pulling the strings. And it would seem that the discussion on climate change, on COVID, and all that seems to be submitted to side discussion that are really driving. And so it would seem that when Bezos says something or Zuckerberg says something, he doesn't need a platform, he doesn't need an assembly, he just takes the decision and they decide to sell the COVID vaccine, yes or no, and to enter in a country, yes or no, and to be in Africa or in Europe, yes or no. So it would seem that all our public health reasoning that were, you know, like 20, 30 years ago, without citing any age of anyone, may make some kind of sense, that TEDos may look like a fantastic advice, but an empty discussion. So don't you have the impression that we, without entering, you know, replacing the World Bank on IMF or the Ministry of Finance, what is really deciding if hunger will be in Africa is the interest rate that the US or China is deciding, and not what public health officers are thinking. So don't we have to think slightly differently, not submit ourselves to economy and finance, but maybe don't we have to have a reading that is slightly different over?
I'd just like the conversation to go on now because I don't have answers, Jean-Luc, when you talk like that. But there are people here who are very active practitioners who are building bridges, and I'd love to hear, and I can see them. They may not want to talk, but those who do, let's talk about practical ways. Thank you.
Well, thank you for this prompt. Let's turn to Annie Feldham, and I have no other hands after Annie, so please propose your turn. Annie first.
Thank you. My first rant here after summer was about how badly women are doing globally, and I couldn't see anywhere in the world where the situation of women in all different contexts was worsening, and that is dreadful. I've got something different I want to say, and it very much reflects what Farhad just said, and I think the real conundrum is that so many governments are not listening to the international agencies. It's almost as if they've gone deaf to what the UN might be saying. And certainly, I absolutely agree with what people have been saying today, but none of this, absolutely none of this, penetrates the everyday political discourse and prioritization of where I live here in the UK. It just doesn't get through. And it not only that is that I can see, and also if you look at the Italian attitude to migrants, it's almost as if it's a sort of anti-globalization, that we're not working together, that we are not even working together in our own countries, because as we've talked a lot, the various facets of inequality, certainly in the UK, are getting stronger. And so whilst, I won't talk what we're doing locally, because we are building bridges and we are talking about devolution, which might seem funny to somebody when I've complained so many times how centralised the English government practice is. So it's terrible to hear what's happening in poor countries. And I absolutely am out of ideas, having worked in these sorts of areas for several decades, of how to turn country governments from rich countries so they look at this. Because, and I'm very pleased to hear of us using our COVID experience to ask the questions: what does this tell us about how we make a difference, how we form partnerships in these wider contexts? And I do sound very gloomy, but the bad government is reflected in lots of sectors, and yes, it does form a rather complete and somewhat dismal whole. Sorry not to be more positive. I will try.
Just don't give up, don't give up, don't give up. It's now more important than ever. Farhan's point that we need a connected narrative.
Yes.
That we're prepared to use, so important. We've been working really hard on the narrative on the global crisis. And I'm just asking you, Annie, don't give up. It's great that you continue coming.
We're still banging away at it.
And there might be all sorts of changes in the UK in the next 2 years.
Hopefully.
We all keep our fingers crossed. Thank you, Annie. I would like to invite Dr. Claire Rayner before coming to Mike Adamson, Marianne Hazelgrave, and Karen Palmer. Claire, the floor is yours.
I think what I was going to say fits in rather well after what Annie has said. I can mention a little bit about ENT workers specifically, as David requested. And I agree, everything isn't just about COVID, but I feel that it exemplifies how, I can only speak for Britain, we are not protecting each other or working together. And I think You know, on the one hand, as David said, we have healthcare workers at very significant risk here from the illness, a shortage of healthcare workers across the world. But at the same time, we've got people who are most vulnerable in society not being protected now at all. And I feel that we've gone back, you know, to a time before there was any proper healthcare in the UK. You know, I just feel there's such a sense of individualism. So COVID is an example of what's going on. And I think what's particularly hard now is both how healthcare workers and other workers are being damaged by it, but also how we're not protecting our most vulnerable in our society. I don't understand how people who've had transplants, who have severe immune suppression, how they can go to a hospital that spent all that money on treating them, and then no staff around them are even wearing a simple mask. I just do not understand. It's giving with one hand and taking away with another. So I feel like we need to look after each other in the small communities again, which sounds awfully idealistic, but I think we do have to start pulling together in those smaller ways. I totally hear what David is saying about these global things all being interlinked. We've got to look smaller. I think I can speak occupationally. Climate change is accelerating so fast. We talk about carbon emissions and various things, but there are some basic things like not producing plastic so much. It's a highly toxic, highly damaging to the environment. That's just one thing. We really need to pull back on those unnecessary things that none of us need to buy and which are highly polluting. So I'm ranging all over the place, but I think it fits. Thank you, David, for talking about the damage that the virus and perhaps other viruses and illnesses have done to all sorts of people. Regarding ear, nose and throat specialists, particularly in those staff, I think they've been most neglected. But if you think about it, if you're looking down somebody's throat, ears, nose, you're as close as possible to the most highly infectious areas that you can be. And across the world, the first healthcare workers to die were ear, nose and throat and eye specialists. And there is no protection for them now. So I guess that's my word on those. You've got things like the tonsils, which store the virus, you know, stuff like that. So I think that's a very specific sort of bit. I hope that helps, but yeah. I remember once a priest that I know gave a sermon, and he said, he used the eye of the needle analogy. He said, when things are like this across the world, he said, you have to keep going. Just like David said, he said, it's like to keep going, even in these everyday things, is like getting through the eye of the needle when things are so tough in the world. So I remember that. I have it printed out on my desk. It's what we have to do.
Thank you for sharing that with us, Claire. We can feel the emotion, but indeed finishing on this positive note needs to keep going. Thank you so much, Claire, for being with us and keeping on sharing what you are seeing around you. Thank you. Let's keep going with those of you who want to share. Also, Mike Adamson from the Red Cross, the floor is yours.
Hi, everyone. Thank you, David, as ever. I mean, I think it's hard to make sense of it, isn't it? And sometimes I think we need a chorus, you know, of lines that we come back to that capture the connections between these, you know, from climate justice to social justice to economic justice, and then how we have agency within that. And I've recently been in Ethiopia, in Tigray, and you know, saw the impact not only of the conflict, in which, you know, more people have died in the last 2 years than actually in Ukraine, and then the impact of 5 droughts in 6 years. But I also saw amazing, you know, volunteer leadership on the ground of young people, mobilizing to make a difference, and creating breakfast clubs from nothing, and so on, as well as people just, as I say, making, offering basic humanitarian support in the most difficult of circumstances. I find it really inspiring. And similarly, when I see here in the UK, talk to some of our refugee support workers who are in the the thick of the most hostile, toxic public discourse around refugees and asylum seekers, continue to be, their compassion and courage in their everyday, work is just, I just find it totally inspiring, and how they, maintain a sense of agency. And I suppose one the things that I observe as we try to practice our, collaborate, the recognition that even though people think of the Red Cross as some enormous organization, actually we're tiny in relation to the scale of needs that we're trying to respond to, and that aren't static anyway. But with the Libya tragedy and the Morocco 2 days before, how we create the space to collaborate effectively and practice our leadership differently. And one of the things that I'm just observing is you've got this amazing agency and commitment still on the ground from people, be it in Ethiopia or be it here in the UK. But actually, for organization, we're so fragmented, I think. It gets harder, and particularly when individual organizations are facing budget pressures, to actually make the time to collaborate effectively, to have the patience to listen to other leaders' personal and organizational theories of change, and to keep moving when there's a greater sense of jeopardy. You've got less time, less money, and a greater sense of jeopardy that is affecting everyone because of the threats that we're all trying to deal with in both our personal and professional lives. It's just how we nurture, how we recognize that, because sometimes these things are about recognizing them in order to look after ourselves and each other. And whether, as I say, that's the frontline support workers or volunteers in our case, or the leaders who are asking to spend their time on collaborations. And I'm just struck by the fragmentation, which doesn't help us, even on climate. Are we really putting our best foot forward? And you look at the proliferation of organizations that are doing good work, but actually it's just in terms of coherence to actually be able to make it. It's hard. It's harder to collaborate because there's so many. So I'm both encouraged by this extraordinary sense of agency that people have, the fact that both on the ground and the leaders who are trying to make the time in very difficult circumstances. And I think if we don't address the fragmentation through the different kind of leadership, then we look incoherent to governments as well. I just think, who are they supposed to talk to? Because there's gazillions of us. And we've got to make it easier for them to engage, and we've got to make it, and therefore our messaging, which is why I come back to where I started, we need a chorus of what we come back to that links, climate justice to economic justice, social justice, and then our expectations of leaders and how difficult that is. We should expect it to be difficult, but actually how we're investing in each other and nurturing each other to actually, to move the dial. That's, I don't know if that helps, but that's what's on my mind right now.
Well, I find that very, very helpful, Mike, and resonating certainly very strongly with conversations we have here at Foresti. David, I keep you for the last word because we have a line of colleagues who want to share their thoughts. So let us turn to Marianne Hazelgrave. Please keep it relatively short. We have 10 minutes left, and you're several wanting to share your thoughts. Marianne.
Thank you. Thank you very much. I've got one main point to make, which I think is underlying what has been said, but has not been mentioned. It's an issue of political will. And what we're seeing and what we're talking about, we're having a conference at the UN in Geneva next month of civil society organizations, and what we're calling de-democratization. Now, there is no such word, but the world and so many governments are swinging far to the right, and that does not help us at all. So that we have to look at the political situation. The political situation is the UN Secretary General has lost his power because governments aren't listening to him. And that this is something we need to take into account. And in the context of that, when we talk about the Sustainable Development Goals, they're way off track and we've only got 7 years. I don't believe, David, we can get them on track without some miracle happening. But the point about the SDGs, and we all make the same mistake, they are interlinked. We've been talking a lot about climate change. Climate change is only one pillar. There are other pillars. There's the economic pillar and also the social pillar. That's where health is. That's where women are, and so on. And we have to see the linkages so that when we're talking, if we're talking about food, if we're talking about something else, what about water? Without water, you've got no food. You've got an awful lot of other things missing. It affects health. We've got to look broadly at the SDGs to see how they link together, because that was what they were aimed to do. And quite honestly, it hasn't happened. So we need a total rethink, and we need to really get down to it, the nuts and bolts. Thank you.
Important point. Thank you. Thank you, Marianne. Let's turn to Karen. Karen Palmer, please.
Hi. So, you know, what everybody says, what I hear from Jean-Luc and from Annie and from Claire and from Mike and from Marianne is, and in particular, what Marianne just said, you know, she sums up in this sentence: the general failure is the lack of the understanding of the interlinkages and the need to look at them more cohesively. What I hear from that is the sticker that sits on my computer every day. It says language shapes change. And this was, of course, the title of the report that we shared last year. But it seems like there's just not this common narrative of what the storyline is. And we need to tie that together and create that in a way that people understand and that resonates. You know, David, when you first spoke, you talked about public health restrictions, and yet they were really public and are really public health protections, not restrictions. And so when we use this kind of language, it shapes the change and creates, you know, part of the chaos that we are all living through right now. So just two other quick points. David, you asked me when we first spoke, I mentioned that the headline today in British Columbia is British Columbia to reinstate mask mandate in all healthcare settings. So that's happening right now. We never believed it would happen again, and yet there it is. I mean, there's been huge conversation about this in the public and in social media, and yet there it is. Yet the adjacent headline says no plans for school masking in BC as BC renews mandate for healthcare settings. So there's this contradiction between, it's an airborne virus, you should wear a mask in a hospital, you should not wear a baggy blue mask, you should actually wear an N95, but you can't get it in schools. Or if children get it, they're not going to bring it home to their parents and grandparents. So this kind of confusing language and confusing conception of the problem, I think, is very difficult for people, and they just throw up their hands and say, forget it, I'm just going to go on with my life. So, you know, I think we could work on how to create a common narrative that becomes, you know, almost a slogan, a brand, you know, a way of communicating about these things that might help the world to understand what we mean by these kinds of interconnections. That's it.
No, thank you. Thank you, Karen, again, resonating so strongly. I want David to talk about our reflections on the 2030 agenda, exactly in that vein. But for now, let's turn to Lynn Brown. Welcome to you. Here you go.
Thanks. Good to see you guys. I think for me, if you look at the global governance system, which is largely the UN in many senses, it doesn't actually have any teeth. But as in many things, that's not exposed until somebody behaves in a way that really shows it. So I think for me, part of the issue is that we have not recognized the broader impacts of Russia, Ukraine, and Afghanistan. You have Afghanistan making 50% of its people non-existent, invisible. You have Russia storming into another sovereign state. And the reality is the global governance system, when someone pushes it that hard, has no answers. And I think when you see that sort of general societal type peer pressure agreement then broken down, it filters out in many, many different ways. So if I look across Africa, you have a couple of players, for example, in China and Russia, who often don't subscribe to more global agreements, but they're giving out free food and free this and investing and bringing in their workers and putting Africa in more conflict, more debt, dealing with leaders who may not be public servants for their own people. So I think, we failed to recognize the consequences of Russia, Ukraine. We recognize the consequences of Afghanistan, but I'm not sure that we recognize the amount of damage that has done to a sort of peer pressure global governance system and how widely it's going out. I mean, it was good to hear from Mike, because I think that, maybe the saving grace is that when people in countries see that their leaders are not engaged or are behaving in ways that do not benefit them, that it does foster engagement at the local level and more agency and more choice. And maybe that will well up to challenge the governance systems that we have.
Important and very, very clearly articulated. Thank you, Lynn. Turning to Sarah. Sarah Phillips, please.
Thank you. I'll be brief. Thank you very much, and that was really helpful. I was looking forward to today because there's lots of news bobbing about again, and I can feel the anxiety in the population, if you like, and around of COVID and what will happen. And I heard somebody saying, "Oh, we're going to run into a lockdown again," and I just haven't heard that for so long. I thought, no, we'll never do that again. And then I just thought, oh, and things like that. I just got the alcohol wipes out and did a few things. And remember what Maria said at something about a week or so ago, just not relying on vaccines anyway, doing what we can with what we've got. But the thought of wearing a mask again would just makes me feel ill. The thought that has to happen is just awful. But some positive stuff. Just some positive stuff. I'm working in organizational development. I'm going to move into leadership next, from culture to leadership. So that's really good. So it's a nice move. But at the moment, I'm doing some analysis and things, and I can see some shifts. And I saw some shifts this week and the other week, and it was more understanding of what is collective leadership and what is distributed decision making. But it's not through all levels. So that's creating that sort of approach. But that means working together in the collaborative space. So we have these collaborative communities of practice, and it's like, well, what are we doing here? What is this sort of thing? It takes forever. But what I did was I brought it in line this week with NHS Impact, which is an improvement thing nationally that's come in, with a thing that's been going on for 7 years, and it's that frustration of embed and spread. And it's like, well, how do we do this? And then a current thing that kind of went a bit, ooh, what are you doing that for? And it was collective leadership, and who's done that? Who's authorized that? And that really helped people sort of see where we were going, and it made sense to them. That's OD people though, so they tend to be receptive to that. So I mean, I thought that was really positive, but I think it is really, really tough and I keep thinking about what you said about unlearning and the leaders, and it's all over at the moment, unlearning things. And I think it is tough for leaders, and I include myself in that. I've still got traditional ways in some things. So I think we have to keep that in mind. And I loved what was said about collective narrative, chorus. I'm trying to get people to sort of think in that way. I think that's enough. It was really helpful today and really helpful to listen to everyone. So thanks very much again.
Lovely. Thank you. Thank you, Sarah. I would love to discuss more about what you've picked up as you are making that shift in your professional life. David, for
Thank you, Flo.
and closing, please.
Sarah, you have a habit so often in these conversations of just capturing where we get to, and thank you for coming in where you have. We started with some very specific issues, and quite rightly, Farhang said, hang on a bit, they're all connected and we need a narrative. And then gradually through the conversation, we've been thinking about what that narrative might be. And then you've reminded us that it's more than a narrative. It's actually new ways of working and new ways of leading. And together, we all do believe, those of us who are working on it, and I include Mike in this, we believe in systems leadership, particularly the people-centered systems leadership that we've been working on. But there are ways to get there. Twee wrote to me a note just now, and I hope she won't mind. I'm going to steal from what you've just said, Twee, because the memorable words that we've had begin with C, the letter C in English. So the challenge is that a lot of the narrative is chaotic, is confusing, and leads to people having quite widespread concerns. It's negative stuff. It leads to people thinking in a very self-protected way. To get through that, point 2, we need a common narrative that we can share with a chorus that encourages collaboration and collective action. And just to comment on that, collective action doesn't come easily. Just any one of you here has been investing many, many, many years of your lives in trying to encourage collective action. And it's hard to do, especially when there's people hell-bent on trying to prevent it happening. Point 3, that leads to conversations. It leads to convergence. It leads to coherence and commitment, and the real willingness to work together. That then takes us to number 4, where people make choices that are best for themselves and their families and their communities and the generations to come through having greater agency. And they're ready to confront the vested interests that are constantly trying to disempower them. So those are really, I think, 4 things that have come through. And I'm sure there are others. But number 1, chaos, confusion, conflict, concern, bad stuff. Number 2, the need for a common narrative that's put out through a chorus, collective collaboration. Number 3, that leads to conversations and connections, increased coverage, commitment, coherence, converging. And number 4, that through that, we develop the agency that enables us to choose, but also importantly, that gives us the courage to confront vested interests. Anyway, those are just 4 things, and I thank everybody for being with us. We keep trying about every month, and there are people who didn't speak here, but who've got very important roles in international organizations, in universities, and health services around the world, from all over the place. And whether you spoke or whether you didn't speak, thanks for coming. Thanks for getting up early, Karen Palmer, British Columbia. But thanks also to those of you who've stayed late. And there's Rafil Way connecting from South Africa. Just thanks for being here.